All right, we're gonna get started now. There's one or two speakers that we're waiting on, but please have a moment of silence for all the people that lost their lives through drug abuse and suicide, please. Thank you. I'm going to start off by introducing some people, some guests that are here. I'll start with the my name is Rich Policio from Wethersfield, Hill Elks Lodge number 2308. And I'm going to start with the introductions of some of our officers from our lodge. Tim Vandy's our exalted ruler. Would you like to say a few words? You can step up to the lectern if you like. You want to step up to the lectern? Okay, you're all right. Steam leading knight Trish Newhouse, past exalted ruler, now a trustee Donna Hedman. Presently, Mary Smith, she's from the Wallingford Lodge. She's involved with, she's a drug awareness chairperson for the state of Connecticut Elks Lodge. Her husband, Tom Smith, is next to her, past exalted ruler and a past district deputy. Our town manager, Ray Carpentino, is sitting in the back. Chief, my buddy, Chief Klett. Okay, we're going to get started. I'm just going to say a few words. I personally want to thank everybody and each and every one of you on the panel for their time and expertise. I want to thank the director, Charles Brown, for he's a director of Central Connecticut Health District, who this year we partnered with in this program. Also like to thank State Rep Kerry Wood, who was a big help. She contacted a lot of people in the state, and some of them are sitting before us on the panel. Also thank Ray Carpentino, our town manager, Lisa Murata, our mayor, our superintendent of schools, Dr. Zito, Rocky Hill Public Schools, and I apologize, I don't, Donna, you know the super's name in Wethersfield? Oh, okay. And Superintendent Michael Emmett for their help. He's superintendent of Wethersfield Public Schools. John Murphy, without him tonight, we'd be in a little bit of trouble. He's the IT director for the town of Rocky Hill. They just rewired the system, sound system, I guess you could call it, an IT system in this room. So he was very helpful in getting us all set for tonight on the mics. Rita Chabra from the Parks and Rec. She's always a great help when we put on this drug awareness and suicide prevention program. All the businesses that helped us, especially those that let us put up our flyers on their front doors or any part of their business. And lastly, Wethersfield Rock Hill Elks Lodge 2308 for always the last 5 years plus for hosting this most important program. Drug and suicide are still taking many two lives. It's devastating. Many families, there's not many families that one way or another are not touched by drugs or suicide. My son was addicted to heroin, thank God he's been clean for 9 years. 2 of my nieces committed suicide 11 months apart. They were sisters. So there's, unfortunately, everybody's touched by this devastating drug and suicide problem we have in Connecticut and the United States. Just one age that really struck me last year. I don't remember if I read it or a panel. No, I did read it. One of the highest rates of suicide in the United States is kids 10 to 14 years old. The choice of how they commit suicide is guns, which is not much of a surprise, considering there's probably 330 million guns in this country, almost one for every person. As most of us know on the panel, and maybe in the audience, that September is a suicide prevention month. And last year I got the number wrong, but it's 988. You can call 988 if you need help. So we're going to start the panel, and I'm just going to go the way that people contacted me. There's no reason, that somebody's first or whatever. So I'm just going to do it that way. So Sarah from the Central Connecticut Health District will be first. Thank you.
Actually, Rich, I'll jump in.
Okay.
We're a tag team.
Oh, okay. So Charles Brown, the director of the Central Connecticut Health District, will be our first speaker. Thank you.
Thank you. So we're the Central Connecticut Health District. We've been, are the health department for Rocky Hill, Wethersfield, Berlin, and Newington, serving about 99,000 people, residents all told. I've been the director here coming up next week it will be 10 years at the health district. And when I came on as the director, one of the things that we really wanted to focus on was to allow data to lead us to where the troubles that we needed to address. So we were looking at, and just about every health data as far as diseases comes across my desk eventually. One of the things that we did notice at the time when I first started was hepatitis C cases were very high. And so we started looking at it and digging into that data. And we noticed that a lot of the cases were younger than what we would have expected. Now, what's the real reason? Why does somebody generally get hepatitis C when they're young? It's not organ transplant. It's usually intravenous drug use. So we really started to delve into this and say, why is the drug use really causing this hep C? And is that the canary in the mine shaft? So we started talking with our partners, our towns, with police, started talking with our social service folks, and really found that, we needed to be able to address this as a public health issue. So we brought all of our towns together. We brought folks from, the business community, from schools, and really asked a very simple question. And that question was, how can we help? So at the time, there wasn't a lot of dollars. There wasn't really any funding whatsoever. But at the local level, really, it doesn't need to be that. Really how we can help is how we can bring people together of like mind, how we can actually, trade information and successes. So we really had, the opportunity to bring together groups around prevention, around response, and about recovery. So through that conversation with our partners among our towns, we actually were able to apply for a grant from the Department of Mental Health and Addiction Services for a statewide opioid response. So we formalized that program, and we actually started to, bring folks together, actually hired a recovery coach, Sarah, who's next to me here, to be out there to meet people where they're at in the community. One of the things, as I mentioned at the beginning of this, was we started to look at data, and we wanted data to really lead where we go within the communities. So we have, the opportunity to see data on overdoses. through a system called OD Map. And we utilize that information to really help Sarah target some of the areas where, we're starting to see more activity within the communities, where there's more need. So utilizing that data to be able to, help our response. In addition to that, we use a system called Epicenter, which takes hospital data for overdoses and provides that information to us. And we actually share that information every month. We have a Central Connecticut Opioid Coalition that meets monthly to be able to share data and to be able to coordinate efforts about response overall. One of the good news that I will say, over the past 5 years, in Rocky Hill especially, we've seen a decline in the number of overdoses that are fatal. We've seen a decline in the number of overdoses overall. And part of that reason is because we've been trying to saturate the community with as much Narcan and naloxone as we could possibly get out there. So if you don't have the opportunity to be able to have Narcan available to you, talk to Sarah, because she's been doing a lot of trainings with our clinical health services folks out there to really train people to have that medication, that life-saving medication, so that it can be utilized where it's needed. The more Narcan that we have out there, the less mortality we're actually going to see. We're still going to continue working to use that data and provide that data back out to the communities. We have an epidemiologist on our staff now after COVID, and part of her funding actually is coming from an overdose data to action grant that we're working with the Hartford Health Department, but they have a regional response. So we're working with other communities to be able to really look at how we can use that data to be more effective. So our epidemiologist provides information to Sarah, and Sarah is the one that's actually out there where the rubber meets the road. Now, I'll turn it over to you, Sarah, to talk a little bit about what you do.
How do I turn? Okay. So my name's Sarah Piatti. I am the recovery coach and recovery support specialist for Central Connecticut Health District. I've been there since, for the most part, I left for a little bit, since 2019, shortly after they got the grant. And part of the qualification to be a recovery support specialist and a recovery coach is lived experience. So with that being said, I'm a woman in long-term recovery from the disease of addiction. And when I first started working for the health district, I had this grand idea that I was just going to go save everybody. Everyone I met was going to get this wonderful thing called recovery and their life was going to be great. And I shortly after I started realized that's not what it's about. What it's about is keeping people alive another day. So I do outreach on the Berlin Turnpike, the Silestine Highway. I'm out there with Narcan. I'm out there with xylazine strips now. I'm out there with fentanyl strips. And I give them to people who are in active addiction to try to keep them alive for another day until they're ready for this journey. And they may never be ready, and that's really not my business. My business is how can we keep them safe? And that's exactly what we're doing and trying to get people connected to services. As Charlie mentioned, as of 6 months ago, we started doing a lot of community-based Narcan trainings. So myself and the nurse who is my boss, Lisa, at the health district, her and I go wherever we're asked to go and do Narcan training. So we did one at the Rocky Hill Senior Center for the community. We did one at the Senior Center for the seniors. We just recently did one in Wethersfield at the community center. I think that was last week. And we're getting ready to do one, I believe is it Newington with the teens? Yep. We're getting ready to do one in Newington for the teens and for a group of teens and their guardians. We're going to do a group Narcan training, and then we're going to break them into groups to see how we can help. And actually, that's the name of the grant we're under for SOAR. It's how can we help? So I brought cards and information, and like Charlie said, if anyone needs Narcan or wants to set up a Narcan training, please feel free to talk to me after the meeting.
Thank you. Before we go on to the next speaker, I'd like to introduce Mayor Lisa Murata. Thank you for your help, Lisa. Would you like to speak and say a few words? There's a handheld mic I can get you, or you can come up to the lectern. Lisa also was a great help the last several years with the Elks Lodge with this program.
Well, good evening, and thank you for the opportunity to say hello to everyone. I'm thrilled to be here again this year, and I can't thank you enough for providing this education forum and the resources for our community. It's so super important. I love to hear about the work that you're doing in the community. I'm already taking notes about it so that I can share it with other members of the community. I'm happy to see folks here in the audience. And is this recorded? Because this would be great. I'm glad that we'll be able to show it.
Yeah, it's being recorded, and I think John said tomorrow he's going to put it on
Our
YouTube.
special. Yeah. Yeah. Well, again, I just want to thank each and every one of you. I have a special place in my heart for this type of outreach. I started my career in crisis counseling and helping folks with addiction and mental health use, and I now serve on the governor's opioid settlement advisory council. So we're the ones putting the money into the community. So thank you for what you do.
You're welcome. Thank you. Yeah, Lisa was always, like I said, over the last several years, it's always a great help with this, with the Elks Lodge in general and with this program. We're going to go to Melissa D.C. Good. That's your married name, right? Yeah. Okay, and she's from Institute of Living, and she has two of her employees with her. Ray
and David.
and David. Thank you. Thanks again for being here.
Well, thank you for having us. I think the first thing I want to say is suicide. We don't talk enough about it. Look at the room. It's not a very glamorous topic to talk about. I was at the Prevention Palooza last week, and we were handing out Narcan, and nobody wanted to take it. They said, "Oh, I don't need that. We don't need to talk about, we don't need a lockbox. We don't need to talk about suicide, not in my backyard." And so, if anything I want to stress, we have to talk about it. Talking about suicide does not put the idea in someone's head. That's a myth. Most people believe that to be true. One thing that we do at the Institute of Living is we do a lot of community education. We go into the schools, we go into the community centers. There was a death by suicide in West Hartford, a 15-year-old, and we're going there next Sunday for 2 hours to talk to the community about suicide. I don't want to talk after a suicide. I want to talk now, before a suicide. I want to get the folks in the room, share, have a conversation, sit with them, talk about what you can do, right? We have to have the conversation. So Rich was right that ages 10 to 14, suicide is the number 2 killer. Number 2. And it is preventable. We need to have the conversation. If you notice your loved one struggling, acting out of sorts, and you know, right? You all have that feeling that something's going on if they're feeling helpless, hopeless, they're oversleeping or not sleeping, right? Pulling away from activities. Or they're talking about suicide, right? I work with a lot of parents that say, "Oh, they're just being dramatic," or "They're manipulative." Guess what? Who cares? Give them the attention they need. Have a conversation. Open those lines of communications. We talk about creating safe spaces. I myself, in the middle of COVID, had to talk to my son about suicide. That's hard. Sure, I do it all the time, but with your own family? And he wasn't. He said no, and we connected him with a therapist. So we have to have the conversation. We have to see the warning signs, and we have to let them know that hope is around. Hope is available. Treatment is possible. Suicide does not have to be the answer. We offer mini programs at the Institute of Living. We have our flyers over there. In addition to therapy, medication, we also offer something called holistic healing. So for some, therapy is not the answer. For some, it's yoga. Others journal. Some love music. Anyone has their own outlet for what works for them. But you can be the first person to make a difference. You can be the difference in that person's life by saying, how are you? I'm concerned about you. Something else is going on. Can we talk? That's really all it takes, is to just really open the doors, to have more community conversations before a tragedy. And I applaud our recovery support specialist. I'm sitting between two amazing recovery support specialists, and they're hired to share their story. Because what we have found is by sharing your story helps others. When we share that we are in pain, it's easier for the others to share they're in pain. And we don't have to hold that risk ourselves, right? We share the risk amongst us. And I'm so proud to be between these two because they're living examples of hope, treatment, recovery, and really the joy of living. And so every year in September, we put on a World Suicide Prevention Day conference. And this year, our theme was the joy of living. Because suicide is often a momentary thought. And most individuals never are suicidal again. It's a momentary thought. It could be an impulsive act. And that's why, again, Rich, to your point, firearms, 50% suicides end in death because of a suicide. And so what keeps us alive, what keeps us living, it's the connections we have with one another, right? It's the things that we're passionate about. And so one thing I really would love is to keep coming back, whether we're behind the microphone or we're sitting next to one another, is to have these conversations, to not be afraid of them, and to just check in on someone, check in on your loved one, check in on your child, and ask the question, are you okay? So I'm going to hand it over to my colleagues to share a little bit about their experience and journey.
Just for 1 second. This is for the parents and brothers and sisters, family members. If somebody comes to you in your family or a friend that's addicted to drugs, there's nothing to be ashamed of. We're not judging anybody here. I stuck by my son day in, day out, year after year. Now, he got clean on his own. He just made up his mind. But the worst thing you can do, and it happens, and the experts probably know more about it than I do, the worst thing you can do is abandon somebody or kick them out of the house. That tough love is a bunch of baloney. You have to tell the person that you love them. You have to hug them. Don't kick them out of the house, because I'll tell you what, you kick them out of the house, and I know this has happened, you'll never see that person again. They go out in the street and they overdose and die. So this is nothing about judgmental. You have to hug your kids especially. And don't say, oh, gee, you'll never amount to 2 cents of anything. You're a drug, you're into drugs, and you have to do just the opposite. You have to hug them and tell them you love them and get them the help they need. Thank you.
I'll jump in. Hi, my name is Ray, and I've been in recovery for about 5 years now. I work with Melissa and David at the Institute of Living, and I really like my job. A little bit of backstory about myself. I was advanced from my age growing up. I was a smart kid in class, was picked on, bullied, and became kind of a social outlet. And because of that, I isolated myself to protect myself. And it worked great, but it's not really productive. It didn't help me to grow, to learn, to communicate, to connect, to be with other people. We're social beings. We're meant to coexist and to work with each other in a family, in a community, in a town, nation. I isolated myself and kind of stunted my growth. Did really well in school, educationally, but socially, not so much. Went away to college, discovered drinking. And it fixed everything. It helped me communicate, felt comfortable around people. So it started out as a Friday night, Saturday night, turned into a weekend, and that turned into a weekday. And before I knew it, I was drinking pretty steadily. And I used alcohol to cope, feel like I fit in, to feel better about myself. It was a coping mechanism. And 25 years later, I finally made the decision to make a change. I was fully successful. Most people didn't even know I drank. I drank in isolation. I drank by myself. But it really became the focus of my life. And it caused problems. It did. Not devastating, but I wasn't a happy person. And that's really the reason behind my substance abuse. I wasn't happy. I tried to turn off those feelings. And if I look back upon my history, I wish that I connected, I reached out, or someone reached out to me when I was in high school experiencing those initial feelings. It really would have made a difference. Most abuse issues boil down to not feeling good about yourself, and it's isolation, and it ties hand in hand with suicide. It's really what it's all about. It's isolation. So if you do notice someone struggling, any kind of behavioral change, any kind of changes in their connection with others, be it a family member, a friend, reach out. You can really make a difference. Finally looked and sought out some help. I went to Rushford to go through rehab treatment, and it changed my life. I fought it. I didn't want to do it for years. I got this. I can handle myself. I'm not one of those. I was one of those. I am one of those. And I learned as much about myself as I did from the other people in treatment at that time. It's about acceptance. Accepting yourself for who you are, where you're at. Learning more about what brought you to this place, this time, this position, this mindset. Once you accept it, you can then learn about how you got there and also learn how to work your way out of it and to become better, to be in recovery. When I was at Rushford, I worked with a peer support specialist, and I was able to connect with that person in a completely different way than I was able to connect with the clinician. The clinicians are doctors per se. The doctor knows everything, and the patient's down here. And it's kind of a one-way street. A peer support specialist is someone without book knowledge. It's with lived experience. They've been there, they've done that, they know. And they could talk about their history, their experience. And that's what really sets a peer support specialist apart. I can connect with a person, just like yourself on the Berlin Turnpike, on the Sidestein Highway. You've been there, you know it, you can connect. And that's truly what helps people. It's the connection. So took an interest in becoming a peer support specialist myself, took the course, was placed as an intern at the Institute of Living, and I've been there ever since. Been there for coming about 4 years now, and it's truly made a difference in my life. And it helps me to tell my story and to help others. Hopefully I make a connection and make life a little better for myself and a lot of others. I'll pass it on to David.
Thanks, Ray, and thanks for having us here. My name is David, David Krause. I'm a caseworker and a proud recovery support specialist at the Institute of Living. And Melissa spoke a little bit about our conference this year, the World Suicide Conference, and it was primarily, well, the topic was joy, right? Joy in life and how we find purpose and meaning. And that's what really brought me to the place where I'm at today, which I never would have in a million years have imagined. My story is, well, it has some similarities to Ray. I started a little bit early in high school, and I was a nervous kid. And when I found alcohol at the age of 15, it was just a light bulb went off my head, and it was a savior, and it was an ability for me to be able to, what I thought to be myself, right? This was the true self coming out, and I was able to talk to girls, and I was able to do all these things, and so this continued, and it continued through college, and it continued through my professional life, and the progression of this disease is just is devastating, or it was rather devastating for me, and it cost me a lot of relationships, it cost me a marriage, it cost me time with my daughter, and financially, and a career, and it's just it's amazing as the mind of someone who's in addiction, where they say, oh, I lost this, but I still have that, right? I lost this, but I still have that, until finally there's just nothing left, and that's what happened to me. And when you're in that pit of despair, it's so overwhelming to get out of it that it's for me, I just went into recovery mode, and then back into relapse, until finally, something clicked for me, and I think it was just it was just really despair, and I knew that I had a choice between life or death, and it was that simple. And I have a 16-year-old daughter now, and I'm very, very proud to be a part of her life again. And I look at a 16-year-old David Krause, and I look at a 16-year-old, my daughter, and they could not have been. They're just in completely different people. I grew up in a loving, warm family, but at that time, those resources weren't available, and now I see a change, and I see my daughter being able to get therapy, find a great therapist, and have medication that works for her, and have a great mother and now a father who can really understand the struggles that she's going through. So there's this change and shift, I think, that we're seeing in stigma, where people are talking about it a little bit more. And suicide is one of those things that's obviously extremely difficult to talk about. And we've held conferences in the last 2 years that I've been involved. It's been amazing to see the crowd of people there. And when we open it up to the panel, and we get feedback from the audience, and you have 100 people in the audience, most of them colleagues, talking to each other about their own experiences. And that, how powerful is that? To sit next to a colleague whom you tangentially know, and they're talking about their own really serious personal experiences. And I never thought myself that I would be up here in front of a microphone talking to a group of people about my own experience. That was not my intention in life. But like Ray said, taking this the recovery support specialist course, and giving back what was given to me, like Ray, you know, I had found someone, actually a therapist who happened to be in recovery himself, and I saw what he had, and I wanted what he had because his situation was similar to mine. And it really circles back to what we've been talking about, Melissa and Ray, and which is about hope and joy and finding purpose and meaning. And I can find purpose and meaning in giving back to others now. And I can find purpose and meaning in mending all those relationships and finally having a family that is with me and supports me and loves me. And I can find that compassion and kindness and caring that I can give to others finally. And it's been a journey, a very, very long journey, but I'm happy to say that, boy, I enjoy my work and I enjoy working at the Family Resource Center because I think we do a lot of good for the community, and I'm proud of that work. And I'm glad to be here. So thank you very much.
Thank you, Melissa, Dave, and Ray. I would be remiss if I didn't mention a Elks member from our lodge. She's comes here every year. Linda, thank you for being here. You're here every year. Brittany, you can come up to the panel if you want. Thank you. Also, Chief Klett, I'm sorry I didn't ask if you wanted to say anything. Wanted to say a few words. You're all set? All right. Thank you very much. Thank you, Brittany, for being here. Our next two speakers are from Wheeler Clinic, Amber and Abby, right to my immediate right. Thank you.
Hi, everyone. Thank you, Rich, for having us. Amber and myself work with the Change the Script campaign in the state. We're both project coordinators. I handle a lot of our partnership and advertising and marketing for the state. It's focused primarily on overdose prevention and medication safety. So we do a lot with trying to get the messaging out and have those conversations, both on a broad scale throughout the state and through outreach that I'll let Amber talk more about. But to everybody's point here, as much as we all may know about it, there's so many more conversations to be had about substance use and suicide prevention alike. I think that we come to work every day trying to make the world a better place and save lives where we can, as Sarah mentioned. And so just kind of getting into every avenue that we can through reaching people in ways that they might not always expect it, whether it's through billboards on the highways or in towns, or we work with some of the universities in the state. We work with UConn. We're going to be starting to work with Quinnipiac to reach students, fans of athletic teams, working with the arts so far as advertising through the Bushnell Theater and the XL Center and some of the concert venues in the state down in Bridgeport and across, kind of running the whole gamut of getting the word out and making people comfortable with the content and with one another to have those conversations, recognizing that they're definitely not always going to be easy, but we want them to have the facts. We want them to know about myths of talking about suicide isn't going to make someone have the desire to consider committing suicide, that talking about substance use isn't going to make someone want to try substances, that having the facts is more important than pretending like the problem doesn't exist. And the only way to kind of work on improving those problems is by talking about them, is by getting the resources available to people, and just making sure that the resources are consistently available and that asking for help and consistently offering help is kind of the only way to make progress in the right direction. And we've seen a lot of progress in the last few years with resources like naloxone being available with all of the great work that the organizations in the state are doing, but there's definitely a lot more work to be done. And so we're just happy to be here. We're grateful for the opportunity to say a few words. We have some resources set up in the back table there. A lot of our campaign, and I'm sure Amber has some more to say about some of the resources, but storing that medication safely, disposing of that medication when you no longer need it. So we have some lock boxes in the back of the room and some doTERRA to dispose of medication. Makes it safe to throw away completely in the regular household trash. We don't want folks holding on to things longer than they need them. We don't want little ones experimenting or having access to anything that they shouldn't be taking. We work for the Change the Script campaign, but we are based out of the Connecticut Clearinghouse, which is a program of Wheeler Clinic, and it's got a lot of resources available to the general public. It's a fully functioning library, and there are some trainings available for community members, such as question first aid refer. It's a suicide prevention tactic. It's offered for free a lot of times through the Clearinghouse or partnering organizations, and it just kind of gets the conversation started. It helps you identify warning signs for suicide prevention, and a bunch of other really great programs and resources. Again, there's information about that back there on the table. So help yourselves, and I'll pass it over to Amber.
Hi, everyone. Thank you again for having us. My name's Amber Sagan. I'm also a project coordinator, and I handle our outreach efforts. So we have 2 mobile resource vans that we use to reach the entire state. We're a statewide campaign. So we take those vans out into the community to offer the resources that Abby mentioned. We have 1 van that is reserved primarily for community events. So anybody can go on our website, drugfreect.org, and book that van, and we'll bring all of our resources out into the community. We are out there 7 days a week. We'll be there as early as 7 a.m. We'll stay till as late as 9 p.m. There's 3 of us on staff, so as long as we're available, we'll be there. So that's our first van, and then our second van, we are in the process of preparing, and the goal of that van is to start to have a regular presence in different communities where there may be service gaps. There's so many organizations in the state doing such incredible work. So we've been working with partners like health departments and some like healthcare providers to identify gaps in the state where people may not have access to naloxone, may not have access to test strips. Thankfully, there's more access than there used to be, but there's still some gaps out there. We're trying to reach the unhoused folks of Connecticut. We have, in addition to those harm reduction resources, we're giving out blankets, socks, first aid kits. We know with the rise of xylazine now, there's a bunch of wounds going on, so we're trying to give those first aid kits to try to help those efforts of keeping people healthy. We're looking into doing hygiene kits. In terms of both of those, we're always looking for more partners in the state. If you have a location you'd like us to come with those resources with our van, if you have any ideas of resources that we should be bringing out into the community, we'd be happy to hear about all of that. And then I know the mayor mentioned that she's on the OSAC committee. Me and Abby both Abby sits on the prevention subcommittee of the Alcohol and Drug Policy Council, and I sit on the recovery subcommittee. And one of the things that the recovery subcommittee put out was the Language Matters poster. They do that every few years. So I just wanted to mention that too, of like the language we use is so important. And when we're out in the community, when we're talking to people, to help reduce that stigma and make people more comfortable asking for help, admitting that they need help. So using person-first language, people with substance use disorder, accepting that recovery looks different from everybody. So that's something that poster puts out.
Die by suicide. I was thinking about that. Rather than using the word commit, but you often commit crimes, you're putting a judgment on the word. So if you're just using plain language, die by suicide. It's like someone dies by cancer. Thank you for that. Thank you. It
Yeah,
matters.
absolutely. And it's hard. It's hard. Even I catch myself, even being a part of knowing what that poster says. It's like common language, but the least we could do is try and like try to help break that stigma.
Thank you very much. Wheeler Clinic's been with us for quite a few years when we ran a different type of program. Thank you very much for being here. A couple of, unfortunately, a few of the speakers that were supposed to be here aren't going to be able to make it. One did call, the other ones unfortunately did not. Our next speaker, I first met Brittany 4 or 5 years ago. I think it was 4 years ago when we had this program downstairs in the community center. I don't want to take away, what she's going to tell you, but just unbelievable, unbelievable. She went from an addict to, are you close to your law degree or did you get it? Yeah, close. Well, that's good. It's a long way. You came a long way. I really respect you, and you'll always be in my heart. You're just amazing. But I'll let her speak. It's Brittany, from outstanding athlete. I remember reading about her in the Hartford Courant. She was in the Cromwell High School. Go ahead, Britt.
Wow, those are old newspapers. I'm getting old. How do you do this? Well, thank you. This is a program I'll always come to speak at. So I have the past few years, I guess, for the past 4, maybe -1 with COVID. This is an issue that is extremely dear and near to my heart. I have accomplished a lot in my recovery, but my life still, is surrounded by a lot of death and a lot of people who I have lost to this disease. And so, I guess a little bit about myself. It was weird. I had a very weird experience this past summer. I was a legal intern in federal immigration court with the Department of Justice. And I'm sitting in a judge's chamber, and I am going through my pardon hearing and receiving an absolute pardon from the state of Connecticut during my legal internship. And it was just such a sort of dichotomy of experiences to be working for a judge and then also having my 5 convictions erased from the state of Connecticut. 10 years ago, I was sentenced to 5 years in prison due to crimes committed because of my substance use. And that was really the bottom that hit it for me. The removal from society, and the work that I did on myself while I was incarcerated was really what changed the trajectory of my life. But it took everything from me. It took a lot of people from me, and it was a really challenging time in my life. And it was 5 years of using heroin. Before that, as Rick mentioned, I was an all-state athlete, but the introduction to the drug, it doesn't discriminate against who you are. And so, it was only, a short while until I found myself addicted, and was just unable to stop. And no matter what I tried to do, just couldn't get out of my own way, until, I was forced to be removed from my surroundings, and from my friends that I used with. And so, I think in the tone of this conversation tonight, since entering, and apologies for my being a little late, is actually much more uplifting than some prior years. It sounds like there's a lot of really good things that are happening and on the horizon. The wave of addiction, it doesn't stop, and it manifests in different forms, in different drugs, but there's a lot that is changing. The language, the harm reduction stuff. There's a lot going on that wasn't going on in the past. So I feel a promise to all of the work that is going on. And I think it's extremely important that we give every single person the chance to be who they want to be. I chose to go a different way with my recovery and pursue a different path and really see if I could explore who I really could be and give myself a chance. So with that now, I'm, as Rick mentioned, I'm finishing my law degree. I manage a committee at the state capitol, the Juvenile Justice Policy Oversight Committee. I've been doing that for a few years. And I have full custody of my 2 children and like all of the things which really mean the most to me. So I am here to just be another example of many that you've heard, is that it is possible, and that, if we can, just not give up on any person, and that, it's really important work that we're all doing.
Thank you, Brittany. Quite a story. In 4 years is not that long of a time span, so to speak. But you really, there's no words I can commend you with. But thank God you're where you are now. Our next speaker is going to be Susan from the Governor's Prevention Partnership. Susan, thank you for being here.
And thank you for having me. As you said, my name is Susan Sarmiento, and I'm honored to be here. I am the program manager for community engagement for prevention, and I have been working with the Governor's Prevention Partnership for a little bit over 6 years. My background is doing parent leadership, and so the work that we do, the GPP as we call it, or the Governor's Prevention Partnership, it's we have different programs. We work with youth. We have a program that is called E3. What we do is we empower youth leaders from different communities to lead conversations about prevention. And the work that I do work with parents in the community. We serve the whole state of Connecticut. So, for example, right now I am working with parents in New London. We're leading, they go through some trainings. First, we pick a community champion. And so they bring a couple parent leaders or community leaders from that area. And we train them on parent leadership and to talk about prevention. And after that, we conduct a number of community conversations, usually are 3, and they pick the topic. In this particular area in London, we're talking about opioids. And there's another one that is going to happen in November that they decided to do a second one about cannabis. And so what they do is with our support, we help them to prepare presentations, and they are the ones that are in charge too. They decide who they wanted to be on the table, and they invite a number between 15 and 20 family members, from teachers or people from their community, that they will help them to make a change. And by the 3rd session, they come up with a project, and so they decide to do health fairs, or maybe one of them actually decided to do a TikTok video. So ways that are, parents are busy, as I'm a mother of 2. And so I can totally understand sometimes how they are not really aware of what's going on, right? So, matter of fact, in my hands, I have a bunch of papers because there's so much information that I got. That's one of the things for the work that I do with these community cafes or community conversations, is that we have access to data, which is important. But our community or the parents that I work, they don't, right? So and part of my work and why I feel so empowered and proud of what we do is that I can provide that data to them. And so I train them, and then we're like, okay, what are you guys, what is your community? What are you going to do with it, right? So we turn it, the ball is on your court, right? And so it is really important to provide that. And it changes the way that they see things and how important it is. Simple things, as I heard to many of the colleagues here about the importance of talking about prevention to the youth, right? Talking about your feelings, your emotions, paying attention if we see a behavior changing, right? How to approach it, not to shy away. Another big thing is that we encourage, or in those community conversations, parents and sharing their experiences, right? Because one time we were 14, 16, 18, and 20, and we had experiences in life, and we got away with things sometimes, and sometimes we put ourselves in danger. And these are the type of conversations that we have. One of the just to give you some, information and how powerful it is. Like, for example, there is a data that just came out it's called the Youth Risk Behavior Survey, that it happens every couple years in high schoolers. And one of the things that really got my attention and really like burning to share with this parent group that I'm leading in the next couple of weeks is the percentage of youth that are seriously considering attempting suicide in females. So it's actually higher than male, and also the LGBTQ community. And so these things are so important for us to share, right? Youth that is feeling like they don't feel comfortable at home or at school, right? So how we can turn this data into a conversation, right? So what are we going to do with it? So that's part of the work that we do, and I'm really happy to be here. I commend you for all the work that you do. And if anybody in this room is interested to lead a conversation, like I will be more than happy to help you to do that.
Thank you, Susan. Something just came into my mind. Does anybody have data on the number of elderly that commit suicide? I'm not trying to put you on the spot, but
No, I don't have data, but I do know that the older adults are the highest rate of being diagnosed with depression. Matter of isolation, loss.
I read somewhere a few years ago that suicide rate amongst elderly is fairly high.
And especially older white males who have lost their spouse. They're at a higher risk.
Well, thank you for that. I'm sorry, Mary, would you like to say anything about, as you're the drug awareness chairperson for the Central District? There's at the podium, that mic is live.
Well, just.
You're good.
I'm good?
Yeah,
Oh,
you're
okay. I'd just like to tell you a little bit about what the Elks do for the drug awareness. In addition to honoring Police Officer of the Year with the Nikki Camarena Award, he was a DEA officer who was killed in Mexico, tortured, and then his family and friends in California, where he was from, started the Red Ribbon Week, where kids pledge to not to do drugs, and there's a lot of red ribbon stuff done across the country. It's now done for a whole week in October. Another thing that we do is the drug take back. with the DEA and the police departments. We help them do that and advertise it for them. And then we have our contests for children, the coloring contest, the essay contest, and video contest. And actually, the national winner for the essay contest this past year was sent in by the Torrington Lodge, and the Camarena Award was won by Rocky Hill police officer, who belongs to the Rocky Hill Wethersfield Lodge. Those are the big things. We have trailers that we take around, one trailer, and the Elroy, the elk, who's a costume dressed up for with the drug paraphernalia. And they set the trailer up at a lot of functions that children will be at, and they give out literature and little gifts encouraging to stay drug-free. Thank you.
Thank you, Mary. Trish, would you like to say anything? How did I know you were going to say that? Sergeant? Yeah, Don, excuse me. In order to be recorded, you have to get to the mic, please. Thank you. No, then you're helpful.
My name is Donna Hemman. I'm from Wethersfield. Served in government. Now I'm an elk for the past 26 years. What I wanted to say is to tag along with what Mary talked about. For young children, Elroy the elk, it sounds like a dumb, kind of simple thing, but it really can engage some conversation with younger children and try to engage their parents in receiving some of the literature. If anybody is interested in the drug literature that the Elks do have, all you need to do is ask, and we can make sure that you get that. Any lodge is able to provide that for you or get it for you so you'll have it. There used to be, and I don't know if there still is, the bookmarks. And those were always a good hit for the elementary school children who were learning how to read and starting to read chapter books. And as they get into middle school, were always something nice little that they could keep and use. So don't be afraid to ask us for any of the information that we do have. It's all available to all of you, and it's nationally. It's not just Connecticut.
Thank you, Donna. I'm going to pat the Wethersfield Rocky Hill Elks Lodge on our back, so the proverbial, yeah. But anyway, I don't think, to my knowledge, that anybody, even in the state of Connecticut, and Mary, correct me after, that does this kind of forum for drug awareness. Definitely, they don't do with suicide, because that's not one of our programs. As I mentioned last year, for some reason, I don't know, because I read something, but I decided to integrate the drug awareness with suicide prevention also. But I don't think anybody does as much as Wethersfield Rocky Hill Elks Lodge as far as a panel like this. Yeah. Okay, thank you. Again, in closing, again, I'd like to, yeah, go ahead, Tim. For those of you that weren't here before, Tim is our exalted ruler, which is another organization will be a president.
I'd just like to, on behalf of the Wethersfield Rocky Hill Elks Lodge, thank the town of Rocky Hill, the mayor, the manager, town manager, certainly the police chief, and all the panel that is here tonight for coming out. It's amazing to listen to the stories here. I thank you all for what you can do. If there's anything we can do as Elks, you've heard from people before me. Reach out to us. We can help you. We want to get into the communities. We are in Wethersfield and Rocky Hill. If we can help anywhere there, we'd be honored to do that. And again, I'd be remiss if I didn't thank Rich for putting this together year after year after year. If I could just give you a little. Thank you for doing it.
Salter Roller, thank you very much for the nice comments. We always can use new members for those that want to join. We're on Cromwell Avenue in Rocky Hill. It's up, I can't think of the name of the plaza right now, but it's where Michelangelo's, Elizabeth's Restaurant, that area. It's a storefront. We don't have our own building anymore. But in closing, again, I'd like to thank the panel. And, if we can save one life, then we've accomplished what we started out to do. Also, Sergeant Jeff Foss Rugen, somebody alluded to the police officer that received that high award. It was Sergeant Jeff Foss Rugen from the Rocky Hill Police Department. He received a national award at the National Convention in Texas a few months ago. So we're very proud that we could give him that award, and proud of, obviously, that he was a member, or is a member, of the Rocky Hill Police Department. Again, thank you, and my exalted ruler and the steam leading night, don't fall off your chairs, but this is not a program of the Elks either, but maybe I might branch out and give this to somebody else and maybe take up gun violence. So with that, in closing, again, thank everybody, the mayor, the town manager, Chief Klett. In the back, Melissa Hick, she's the Director of Human Services, and Kelly is, I forget your title, but she's also an employee of the Human Services in Rocky Hill. Thanks again, and have a good, safe night. And I know we saved a life tonight. Thank you very much.